Good afternoon. My name is Zahraa Larian. I have been a community pharmacist for 6 years, and today for about 10 minutes I would like to talk to you about pressure ulcers, which are also known as bed sores, pressure sores, or decubitus ulcers. Today we will quickly define what pressure ulcers are and give a brief introduction. And through looking at how common pressure ulcers are, you will see why this topic is so relevant. We'll look at causes and risk factors for developing pressure ulcers and how they're assessed into 4 stages. We will focus today on prevention of pressure ulcers and then briefly look at managing them before we summarize and conclude our topic. There are different ways to explain what a pressure ulcer is. I got this definition from a Cochrane Review article, and it defines pressure ulcers as a localized injury to the skin or the underlying tissue or both, usually over a bony prominence as a result of pressure or pressure in combination with shear. And that shear is a pulling force on the skin, for example, from bumping into a table. Pressure ulcers are in most cases chronic wounds, which means once they develop, they are often lifelong. They cause discomfort and can progress and decrease a person's quality of life. They can increase the length of hospital stays and can cause serious infections that can see the person lose a limb or even threaten their life. Not to mention, pressure ulcers can become quite expensive to manage over time. Pressure ulcers can develop anywhere, but the more common sites are the sacrum, which is the base of the lower back, the buttocks, elbows, hips, and the pelvis areas, the heels, and the bony prominence on the inside and outside of the ankle. So we know pressure ulcers affect a person's quality of life through pain or discomfort, but what about the financial burden? The Journal of Australian Wound Management Association published that in 2012 in Australia, pressure ulcers management cost over $1.6 billion. And the same journal published a literature review this year on the astounding prevalence of pressure ulcers. They reviewed 38 studies from 11 countries and reported that pressure ulcers occurred in up to 26.7% of hospitalized patients, up to 29% of people living in the community, more than 53% of nursing home residents, and nearly 29% of intensive care unit patients. So I hope these alarming figures do show you why it is important to be aware of and, more importantly, prevent pressure ulcers from occurring. Aside from pressure and shear causing pressure ulcers, there are other risk factors for developing them. I have grouped these into 3 categories. The first is very prolonged periods of sitting or laying down without much movement, for example, from being in bed or in a wheelchair. Some illnesses like diabetes can impair blood circulation around the body. A pressure ulcer is more likely to develop in an area receiving less blood, such as the feet. And weak or fragile skin is more prone to damage and hence ulcers. Unfortunately, these risk factors mean that advancing age, and so the elderly, are at the greatest risk of having pressure ulcers. And of course, for those who have an existing or previous pressure ulcer, there is a greater risk of it progressing in stage. And that's what we'll look at now. How much impact a pressure ulcer has on a person from a financial and quality of life perspective depends on their severity. There are 4 stages of severity. Stage 1, pressure ulcer, is a persistent red spot on the surface of the skin that does not blanch or go white under light pressure. The diagrams are from the Wound Care Information Network. I didn't use photos because, and especially as we progress through the stages, the photos might become offensive to some people. But you can see from the diagram that the skin is intact in stage 1, whereas a stage 2 ulcer involves some skin damage, but just a shallow surface wound. And stage 3 ulcers are deeper, and the fat layer, which is the layer with the circles in the diagram, under the skin may be visible. And the progression of this ulcer becomes a stage 4 ulcer, whereby the bone, tendon, or muscle underneath can be seen through the much deeper lesion. To prevent pressure ulcers, we need to reduce the pressure and the pulling force on the skin. So how do we do that? Well, firstly, through movement, frequently but carefully, so we don't accidentally injure the skin by pulling it. People who can't move themselves should be assisted in turning and repositioning themselves. Secondly, the use of bedding or materials that reduce friction are also a good preventative strategy. Reviews have also found that supportive surfaces are more effective, for example, than ordinary foam mattresses at preventing pressure ulcers, and work by cushioning the vulnerable parts and redistributing pressure more evenly. Such surfaces like mattresses and cushions should be used for the beds, wheelchairs, normal chairs and trolleys, etc. In addition, research showed that people who use sheepskin overlay on their mattresses also developed less pressure ulcers. The therapeutic guidelines gives good recommendations for when you're in bed for prolonged periods and are therefore at risk of pressure ulcers. They recommend to try and avoid raising the bedhead by more than 30 degrees. And if you do, bend your knees using pillows or the position settings on the bed. If lying on your side, fall back a little bit on your bottom to relieve the pressure from your hips. And of course, the heels should always be protected, regardless of what position you are in. Other strategies for prevention include optimizing your general health by drinking plenty of water and having a healthy diet, inspecting your skin on a daily basis, especially the high-risk areas, keeping the skin clean, dry, so it's not in contact with excessive moisture for prolonged periods of time, which makes it weak, and moisturized, so it's not dry and cracking, which makes it more fragile and likely to ulcerate. The use of barrier creams and ointments and dressings can also be helpful in protecting the skin against pressure ulcers, and these can be sought in consultation with your doctor, pharmacist, or nurse. A pressure ulcer, especially in stage 1, is just a red spot on otherwise possibly healthy-looking skin. However, its presence indicates that there is urgent need for pressure relief and a look at those prevention strategies to ensure its healing and prevent the recurrence or an advance to further stages. Management of a particular ulcer is based on the ulcer itself and the judgment of your doctor or nurse. So to reduce the discomfort, pain relief may be prescribed. Wound dressing can include the barrier creams and dressings that optimize pressure balance and moisture balance and prevent infection. There is particular evidence for silver-based dressings as safe and effective for this purpose. Cleaning, dressing, and wound management is done on an individual basis and the advice of your healthcare provider, as it depends on the ulcer itself and as is the management of any infections or swelling. So in summary, I hope today I was able to convey that pressure ulcers or bed sores are caused by pressure, possibly in combination with shear on the skin, usually where there is a bone directly underneath it. There are 4 stages that mark the severity of pressure ulcers depending on its depth, and that prevention is the best way to manage these uncomfortable chronic ulcers that can significantly affect the person's quality of life. The important thing to remember about their management is that regardless of what stage, any pressure ulcer needs immediate attention and appropriate management based on the advice of your healthcare provider. I would like to take this opportunity to thank you for your time today in listening to me and welcome any questions or feedback you have for me. Thank you.